The patient shivers in bed, sweat pouring down his face as the fever climbs higher. He has not caught malaria by accident. His doctor infected him on purpose. This was malariotherapy, a treatment devised in the early 20th century for one of the most dreaded diseases of the time, syphilis. Before the advent of antibiotics, syphilis devastated lives, leading to paralysis, insanity, and death. Desperate for answers, doctors discovered that another disease, malarium, might provide a solution. The idea came from Austrian physician Julius Wagner-Jauregg. He observed that patients with mental illness sometimes improved temporarily after developing high fevers from infections. Building on this, he hypothesized that intentionally inducing fevers could combat certain diseases. In 1917, he began infecting syphilis patients with malaria parasites. The logic was brutal but ingenious. The intense, repeated fevers triggered by malaria could weaken or kill the bacteria responsible for syphilis, Treponema pallidum. Afterward, the malaria could be treated with quinine, a drug already known to be effective. Remarkably, the therapy often worked. Patients who otherwise faced inevitable decline sometimes stabilized or even improved. In an era when syphilis was essentially a death sentence, malariotherapy offered hope. By the 1920s, it had spread across Europe and the United States, hailed as a breakthrough. In 1927, Wagner-Jauregg received the Nobel Prize in Medicine for the discovery, cementing its place as one of the strangest but most celebrated treatments of its time.
But the treatment was dangerous.
Malaria is itself a deadly disease, and not all patients survived. Some died from the induced fevers. Others suffered complications. Even when it worked, the procedure was grueling, subjecting patients to weeks of feverish torment. Still, compared to the alternative of syphilis-induced madness and death, many considered the gamble worthwhile. The practice reflected the medical mindset of the era: aggressive, experimental, and willing to harness one disease against another. It also showed how limited treatment options were before antibiotics. Doctors had little else to offer syphilis patients, besides toxic mercury ointments, arsenic-based drugs, or false hope. Against that backdrop, malaria therapy looked almost miraculous. The triumph was short-lived. In the 1940s, the introduction of penicillin provided a safe, reliable, and far more effective cure for syphilis. Malaria therapy quickly faded into obscurity, remembered more as a historical curiosity than a viable treatment. Yet its story highlights both the ingenuity and the desperation of pre-antibiotic medicine. It also raises ethical questions. Patients often endured horrific suffering, and some died as a result of the therapy. Could it still be considered progress? For many historians, the answer is yes, but with caveats. Wagner-Jauregg's work demonstrated that deliberate fever induction could alter disease outcomes, paving the way for new insights into the immune system. His Nobel Prize, controversial even then, recognized the boldness of the discovery, if not its brutality. Today, malariotherapy is remembered as one of medicine's strangest chapters of time. When doctors use one of humanity's oldest enemies as a weapon against another, stands alongside other desperate measures, like lobotomy or plombage, as evidence of how innovation often emerges from the edge of reason. The next time you think of malaria as purely a scourge, recall the era when it was also hailed briefly, bizarrely, as a cure.